Hi, I'm Dr. Michael Papa. Welcome to our Jupiter location. It's 13 and a half years ago. We're going to give you a little walkthrough and a tutorial of the building. We have a few. I just wanted to show you. We come underneath. A lot of times it's convenient for the patients that they can come in, drive access to our facility. So we're going to take a nice little walk in here. We have two entrances, one in the front of the building and one back here in the back of the building. So Samantha's running the camera for me, and we're going to come on in, and I'm going to show you a little bit here. This is who we are. We also have South Florida Regenerative Medicine. Jupiter West Medical Center is also part of us. As you see here, when you walk into the lobby, we have an elevator, but we're going to take the stairs. We're also, you can see we do regenerative medicine, which you can come on our website and tell you a little bit about our stem cell and PRP, along with the chiropractic and physical therapy. So come on in. Here's the front entrance here, and we're going to wind up going back up the stairs into the main lobby. And we always try to do the light. We won't be out of breath. So most patients that can't, because they're in pain, tend to take the elevator. So we walk in here in the lobby, and this is our lobby area. And what we're going to see here is the front desk area. The front of the building's to my right. And here's a book on Generation ADD. I wrote the book about 10 years ago. It's on attention deficit disorder and ADD. And it's solutions instead of medication. We're going to come on into the main floor. And this here is our main therapy suite and floor. You can see one of my therapists is setting somebody up on traction. And as we walk in here, we're doing some therapy on another patient here, as well as a full floor of physical therapy. We have everything from laser, cold laser therapy, spinal decompression, which we'll show, full exercise bikes, and we treat every age from pediatrics to geriatrics. Full exercise equipment. Come on back. We're going to start in my office, which is right in here. It's where we do most of our consultations and education for our patients. This is Dr. Jason. He's one of our chiropractors. Here we have educational boards for patients, as well as reviewing x-rays. And my desk, which is a nice mess, but you know, a mess means that we're busy, a mess means that we're productive, and a mess means that we're alive and we're working, which is a good thing. So we're going to go to one of our next treatment rooms as we're coming here. And follow me. And here we come here. This room here is another treatment room, which we do what they call flexion distraction. We do it for a lot of stenotic patients, lumbar disc patients, respond really well. Patients who are osteoporotic, osteopenia also do well. So now going to our next room here. Follow me. And this room here is another treatment room where we do flexion distraction, more educational pieces. Education is power. So we always want to show that with patients. This table here to my right is one of our spinal decompression machines. I have a lot of orthopedic surgeons as well as neurosurgeons refer to us. This is an option for patients who do not want disc surgery. It decompresses the disc, and whether it's in the cervical area, which we can set that up, or the lumbar area. And it actually retracts the disc backwards to help avoid surgery. Excuse me. Most patients respond really well to this, and they avoid surgery as long as they, like everybody else in this world, needs to be compliant and has to follow through with the things they're supposed to be doing on their own. Taking care of your own health is the key. We can help you, we can take you there, but when you're home on your own, you have to be doing it. If you're not, then you're going to suffer the consequences. Let's go to our next room. Scott's not allowed to smile on the floor. No smile. Right here on our right, this is our gait scan. And what we utilize this, it is to we make orthotics. Now, the orthotics are made through, and you see that on some of our website, information. As you can see here, patients walk and it gets a digital scan. And what it shows is it shows the patient's heel strike, midfoot, toe off, supination, pronation, and weight distribution. You know, if we do a static here really quick, I'll just show you this. It's going to tell us how much weight the patient's carrying on their heels and just standing and in their forefoot normally, which also, excuse me, creates back issues or hip issues or knee issues. But it gives a perfect situation where we actually send the digital file to the lab and they make an orthotic specific to you. It's not one of these castings like they do, and the podiatrists are doing. We're one of, I think, 2 people in the whole county that does it. We have it from everything from a normal shoe to a dress shoe for females to soccer, but we cover everything for diabetic patients here. We also have them for runners, so they can go with the less expensive running shoe and then have the orthotic to replace for themselves. And with the orthotics, this is the big thing. It's lifetime. So you get a lifetime warranty. For $425, we cast an orthotic to your foot. And in 5 years from now, if it's worn out and you need another one, come on in, you pay a small fee to ship it back, and you get a whole new set of, whole new pair. So you're saving probably hundreds of dollars on shoes because you have an actual custom orthotic for your own insert. We do a lot of school physicals here as well. You got the weight, you have the eye chart right here. We do the sports physicals, camp physicals, and so on. This here is one of our treatment rooms. This here also is an exam room. We have the sink, we have the hospital flooring, and we also do, like I said, we do stem cell therapy, which we have an orthopedic surgeon, Dr. Steris. We have Valerie Fiordolino is our nurse practitioner, or our PA that also does the injections with a nurse, where we do plasma, which is PRP injections into joints. But the stem cell is the newest and probably one of the best preventative surgical procedures now. It's a stem cell to increase cartilage growth. We are South Florida Regenerative Medicine on that. We have our own website, and you can link to our main website, papachiropractic.com, and see what you need to know. Our consults for regenerative medicine and stem cell are at no charge, where most people charge $500 for them. We won't charge because we want the right candidates. Stem cells up and coming, you should look into it if you have any sort of degenerative changes, and we can go through to see who's a candidate or not. We'll go to the next room. Yes, so we can keep going. Come on in. This, we do our exams, we do our physicals in here, and we also have digital x-ray. So pretty much if you're having a problem, we can take x-rays of, this is a pediatric shoulder actually, and I can show you that because that's my son when he was younger, when he had a fracture of his humerus when he fell skiing. The thing is, you have to have the right diagnostic equipment. You have to be able to listen to the patient, ask the right questions, because they're going to tell you what's wrong with them. When you do that, am I down here? Yeah, that camera's so low. Okay. When you do that, you can help the patient. When we do a consult with a patient, our first thing is to determine if they're in the right place. Because if we talk to them and we feel there's other things going on that are more important, that they need to get worked up somewhere else, we will send them out. We want to do what's best for you in your best interest. We don't just want to do things because, for the wrong reasons. Let's put it this way. We're in this pandemic right now. People in the next week are going to go back to work. Just continually wash your hands. Every room we have hand sanitizers on the wall. We wash our hands. We wipe the tables down. We have spray bottles everywhere. But to me, the first step to better health is make an appointment with us. We don't charge for consults. We have other offices which we're going to tour. Our Palm Beach Gardens office, you'll meet Dr. Cologne tomorrow. We'll tour our Port St. Lucie office like this. on Thursday, and they can't see you shaking your head, but you're shaking your head for me. On Thursday, and we're gonna give you a little walkthrough. We're gonna save this, we're gonna put it up on our Facebook page as well. And we have a pretty good Facebook page. I have a personal page, but which is full anyway right now. We have 5,000, we can't go more, but our commercial page has a lot of good information on who we are and what we do. I've been in practice 30 years. We have been I contracted with the high schools for, 15 years at least. We treat sports injuries, shoulders, knees, hips, post-surgical, spine, post-surgical, knee, hip replacements, knee replacements, on top of the most important to me, which is maintenance. We want to get you better, and then you need to maintain your health. Like I always say, you're responsible for your own health. You have nobody to blame but yourself. You can only blame your doctor if they don't educate you on what you need to do. You guys have a great Tuesday, and we'll see you. I'll see you Thursday. Cologne will see you tomorrow. Have a great day. Bye.